Hello, welcome again to the fourth med course. Today we'll be discussing acute rheumatic fever. So let's get started. Acute rheumatic fever is an inflammatory process which involves the joint, the heart, the skin, and the brain. These parts can be affected to several degrees, as we would see subsequently. It is an autoimmune sequelae of a group A beta hemolytic streptococcus infection, and it is usually caused by antibody cross-reactivity. It is primarily a disease of children, with the highest incidence in children 5 to 12 years old. In the US, and as we have seen in Nigeria, the trend is reducing as a result of antibiotic use. So it's no longer as common as it used to be in the olden days. These are the epidemiology. It is important to know that it has no gender predilection. So it is ratio 1:1 in males to females. And as I said earlier, the incidence is reducing worldwide, Nigeria inclusive. The pathophysiology is largely unknown. However, there are suggested theories, and of these suggested theories, the most favored theory is that it is an autoimmune phenomenon, which we would see in subsequent slides. Other suggested theories include the toxic effect of streptococcal products, that is, the toxins of the bacteria. Another theory is the serum sickness-like reaction. However, these are not as supported as the autoimmune phenomenon. The autoimmune phenomenon is supported because in most people with acute rheumatic fever, the blood contains antibodies to the antigens of a streptococcal organism, that is a group A streptococcal organism, that is either a streptolysin O, hyaluronidase, or streptokinase. The autoimmune phenomenon, the one that is more supported for causing this acute rheumatic fever, is the type 2 hypersensitivity reaction, which occurs as a result of a primary group A streptococcal infection, which eventually leads to antibody formation, and then these antibodies now cross-react with body's own antigens, that is, the antigens in joints, in the heart, in the skin, and even in the brain, and then they cause trouble for the body. So this is a diagrammatic illustration. After a streptococcal throat or skin infection, then it goes ahead to form antibody which affects the joint, the brain, the skin, or the nervous system. So, how do they manifest? From the point of initial infection of the throat or the skin by the bacteria to the point of affectation of either the joint, the skin, the brain, or the heart is about 1 to 5 weeks, but an average of 19 days. And most people who have acute rheumatic fever have joint involvement, that is about 75%. Next is carditis, that's heart involvement, which is common, which is present in up to 50% of patients, and chorea and skin involvement are present in 15 to 10%, 15 and 10% respectively. Chorea and subcutaneous nodules, that is skin infections, are present in 15 and 10% of patients respectively. To talk about the heart involvement, it is seen in the first 3 weeks, and the signs that usually peak are you find a new heart murmur, then cardiomegaly. It can also lead in rare severe cases to a heart failure. There can be pericardial friction rub and pericardial effusion. In a long-term sequelae, which usually occurs in about 2 to 10 years after the initial infection, there can be rheumatic heart disease, which is a lecture on its own. The murmur in acute rheumatic fever carditis is called Carey-Combs murmur, and it is characterized as a low-pitched, soft, mid-diastolic flow murmur that is most loud at the apex.